Because of what you said, where a lot of doctors still aren't seeing this as a need to get tested for, vitamin D deficiency rather is probably still misdiagnosed as a number of other things. Is that correct?
Yes, it probably is overlooked in a number of different diseases. Chronic pain, something that's rising significantly in the United States right now. There was a study that was done looking at chronic pain, and they found that patients who had low vitamin D levels, below normal, were using twice as much pain medication as the patients in the pain clinic who had normal vitamin D levels. And so there's a correlation there with how much pain you experience among patients with chronic pain. Another example of a disorder that is sometimes misdiagnosed and is vitamin D deficiency is fibromyalgia, which is one of these chronic pain disorders. Now, I would say that the challenging thing is that because vitamin D is so prevalent, it can sometimes be difficult to tease out cause from effect, okay? And someone who is miserably ill is going to get even less sun exposure, going to be eating the wrong foods, is going to be less physically active. And so you don't want, I'm not saying that everybody with fibromyalgia has vitamin D deficiency, but probably 70% do because 70% of the population is deficient. Sure. And within those groups, and I have examples in the book of that, and I'm sure other practitioners have had similar experiences, is that there are occasional patients with fibromyalgia where that is the primary driver of their pain and fatigue and misery. And when you correct that, they get dramatically better. And you certainly don't want to miss those patients where vitamin D, a simple, inexpensive solution, is the primary driver of their symptom complex.
Could a person be deficient